As Dr. Ferguson makes his incision, y'all get in my Robin Lee's voice.
You gonna narrate this thing?
Your concentration in the bone surgeries
I get a little
on point.
Get a little stressed in there sometimes.
But you don't show it.
But I do notice I can see you like come, you peep, and you keep moving.
Here you go.
I don't know if you just really respecting what I'm doing, or you're afraid I'm gonna ask you to help.
I don't like bone surgery, so you're very studious and you gloved up, then you have your glasses down here like Scrooge McDuck. We've been partners for about 20 plus years.
20 plus.
I know when to leave you alone.
And when is that?
When you really concentrating on
I
animal.
don't want to get quiet, right?
Or you drink some milk.
Among the flurry of furry friends at the clinic is a patient with a returning problem.
So sorry.
Lonnie is a 6-year-old Doberman. We had her since she was a puppy. She's been walking around without putting pressure on her back leg. This is actually her second time around with the same issue. There was some movement between the knee joints. Dr. Ferguson ended up operating on her and fixing it, but she's coming across the same problem again.
Hello, hello.
How you doing, Dr. Ferguson?
Hey, Lonnie.
She said, oh, no.
So I know that man right there. So how you
See
doing?
her trying to fake it and, like, put her leg down, even though she hasn't put weight on it.
Yeah.
She's trying to tell you, I'm all right.
Hey, it's okay. Come on. Well, I can see what's going on. How long it's been?
I'd say about 2 weeks
Okay.
now. She's been lifting her legs, she's staying off of it.
Not even want to put it down.
Not at all.
Okay, let me put a hand on it back here. You want to switch with me, Drill?
She was crying a lot, which is just heartbreaking.
Do we know if that she did something active and bam, it just happened all of a sudden?
She's active. She likes play catch, play fetch.
Like, crazy about it.
All right, girl, I know.
I want an x-ray here, okay? And see if we see any pathology changes in there and really kind of feel and see if I can feel anything. All right, hold tight.
Thank you.
Thank you, sir.
All right, Miss Lonnie. Come on, girl.
Good girl.
Good girl.
All right. I actually repaired Lonnie's right ACL, anterior cruciate ligament, 2 years ago with a prosthetic. And being lame on that same leg is not good. Well, Lonnie's a very active dog, so there is a possibility that she's torn the prosthetic. Dobermans are also prone to having issues with their hip.
Your x-ray for Lonnie is up.
We definitely got a lot of arthritic changes in here, like everywhere. But they do look inflamed up in this area right in here. It could have been running and slipped and tore some fibrous tissue. Something's wrong with the ACL clips we put in the last time, too. I think she probably torn the clip, because that clip really should be going from here to there, not going that way. So that tells me that thing's broken. The orientation of my clip is not where it should be, which kind of cluing me in that we may have a torn prosthetic. And that torn prosthetic is not holding the knee and making it stable, which is causing a lot of extra osteoarthritis, inflammation in the bone, and it's definitely painful. I think I feel a click there, which tells me we may have some meniscal injury. Yeah, we're gonna be a surgery case. So I guess we need to get them scheduled. We probably have some meniscal damage, which makes it a lot tougher with the instability, with the osteoarthritis. Left untreated, Lonnie may never use this leg again. Looking at this knee, we do have some instability in there, which tells me that the prosthetic has broken. We need to go back in that knee. We need to go and take this out and then replace that line that we had in it. While we're in there, I can also repair the meniscus as well.
So she's probably in a lot of pain.
Is there some pain? Yes, but it's more uncomfortableness, and I just learned just to hold it up and not even put it down. Now, it's always a little challenging the second time around. We're older now. Things take longer to heal up than they did 2 years ago, so it's still gonna be a process.
So there's no way around it. We have to do surgery.
Yeah. It always gets tough, you know, when you have to go back in a second time, because the owners have been through this process. And when you're doing an ACL repair, it's not like doing a spay in 3 or 4 days, you know, everything is fine and back to normal. This is a long process of recovering, you know, going through therapy and getting the animal sound and back. And she's upset about having to do it again, you know, because that's her baby. It's kind of ripping at her heart a little bit. It's gonna be a challenging surgery, but we're gonna go ahead and get this repaired so we can make this baby better, and that's what I aim to do.
Damn it.
So Lonnie is like our own kid, so it's very emotional, especially for my wife. You want to see your own kid feel better. So now it's going through it again 2 years later. The emotions got to her again about what we may expect with Lonnie after the surgery.
What's up?
Say hey. Say hey, Gertie. Hey, Harley. We brought Harley and Goldie.
We brought him in to have Harley checks where he's pulling his feathers, and both of them had to have their nails clipped.
They're Jen-Day Conyers, brother and sister. They're 20 years old. We've raised them from babies.
Hey, what's up, everybody?
Good morning.
You all right?
Yes, I'm fine.
How you doing, my friend?
I'm
You all right?
I'm doing great, thank
What you
you.
got on your shoulder, though?
The birds get on my shoulder in the mornings. I get on the computer and look up mail, put a puzzle together. Goldie gets in my shirt.
I'm glad that she spends the time with them she does. Gives me a lot of free time.
Don't bite.
What's up?
She's been pulling her feathers for a couple of years. She stopped laying eggs a couple of years ago.
Uh-huh. In her cage, a lot of toys. Does she have?
Not really. I mean, she's never played with toys.
Okay.
This one plays with juice tops and rolls them everywhere.
What do you find that this one is interested in?
Just looking out the window.
Just looking out the window. We gotta get you more excitement.
Say, I like the computer.
I don't know if we can put a computer in your cage.
She can't fly anymore.
Really? So, because you can't fly, is that why you picking your father?
It's okay.
We'll do a little tape test, see if we got some yeast on that skin.
She looks like a Cornish hen.
Let's check it for a little yeast and bacteria and see. So oftentimes humans and dogs, cats, and birds have opportunistic pathogens on their skin. I mean, it's normal bacterial flora, but when we get an overgrowth, the animal will start plicking or scratching. Worst case scenario, opportunistic pathogens get down to the hair follicles and gets into the blood and makes it septic, which could ultimately lead to a bird's death. Hey, I say that too when I see him. When I see that guy right there, I do the same thing.
Screaming on that bed with you, man.
Oh, this bird has been totally quiet until you.
You love me?
I think there was a hick no. Get a little swab. Birds have a crop. That's kind of where they have their food. You can see the actual swab moving in the crop. Dr. Ferguson, you are my official swab holder. That end came from the mouth. Now I'm going to the other end.
You hold the other end, I hold the mouth.
It's very important that I check both ends, the crop, the oral cavity, and also check the back end, the anus area. There are so many possible pathogens that could be proliferating in this animal, so we definitely want to be very thorough so that we don't miss anything. All right, bird, nice and easy. Sometimes less is more, so I take a piece of tape and put it on the bird. Can you see that? I want to look for some fungus on it. Put it on my slide, and once we check the slide, that lets me know if there's yeast or bacteria on there.
So I can get out of that cage if I want to. Yes, I can.
Okay. So it depends how you look at it. I got good news and bad news. Good news, there's no physical problems with this bird. No bacteria or fungus, none on the chest, and none in the cloaca. And I guess that's kind of bad news because that tells me it's up here.
Just a habit. You can.
It's just like this bird's like the rest of America. like all of us. It's just anxiety. Maybe try to find some toys, but I am gonna try some groovy grape flavored diazepam. We're gonna see if we'll take that. Feather plucking is psychological. I mean, kind of like me, I chew my nails. I try not to, but sometimes I will. A lot of times these guys get bored, especially with all the people home with their animals more. People getting anxiety, birds get anxiety. Good old anxiety medicine typically works.
How many times a day?
Ooh, that feels good.
I want you to kind of watch and see how we tend to do. Other than that, in the meantime, I'm gonna go cut his nails.
Well, I appreciate it. I sure do. Thank you. I thought Dr. Hodges was going to tell me that Harley had cancer or something that was, terribly wrong with her, but it was all in her head. I think it started off not being able to lay eggs and hatch eggs. That's their purpose in life. It's like birdie menopause.
We should be good to go. For a 20-year bird, looks fantastic.
Thank
Okay.
you so much.
All right.
Thank you.
No problem.
I adore these birds. They are my heart.
I just want them to have a good, healthy life and be able to enjoy them as long as possible. And they may end up outliving us.
Jordan, you got the whole body. You ain't need my help. Superwoman.
Continuing their busy day, Dr. Ferguson and his team prepare to re-repair Lonnie's ACL.
Sit down, baby girl. I know, it hurts.
Going in for a second time can be very difficult because things don't quite heal back like they are initially. There's a lot of scar tissue. There's a lot of inflammation. They don't look the same when they did the first time.
All right, ready?
Relax on this wall. Just take a deep breath and get prepared mentally.
You always mentally were prepared.
My Zen moment here. How you supposed to breathe?
Deep breaths.
Breathing in slow, hold it, and then count to 4, breathing out.
Deep breaths.
And I'm bringing it down. This is the first time, I've had this breathing treatment prior to surgery. I think it might be working. It's allowed me to open up my third eye, so I can make sure I'm successful, because I'm going to need all 3 of them in this surgery. You know what? I feel better, Jordan.
It helps.
You ready, Lonnie? Get this old knee fixed up again? So the game plan is to open up, find and remove the old prosthetic, get this knee cleaned out as best we can, replace and put a new prosthetic in, and try to stabilize this knee so that we can be just as good as new. But it all depends on how bad this knee is once we open it up.
So you gotta do something different since you did it before?
No, we're gonna do it the same. Let me see if I can find my prosthetic in here.
There it is.
Come on out of here, buddy.
It was supposed to come out that easy?
Nope, it's broke.
Oh, wow.
When this prosthetic was torn, the fibrous tissue probably did hold a joint stable for a while until it stretched because it had a lot of force on it. Well, let's see. We need to look for this old meniscus here. I see it, but the meniscus done flipped all the way up.
Whoa.
Because that meniscus is flipped, it's almost like if you had something in your sock. Every time you step down, it's causing discomfort. So we have to repair the damaged meniscus before I perform the ACL repair, so we have a nice flat surface so that doesn't cause a lot of stress when we flex and extend it. Osteoarthritis in here, it's terrible. I'm gonna call it boogered up. That's the best word I can use. That meniscus is in bad shape. If I can't repair this meniscus, it's gonna cause a lot of pain, which is gonna cause Lonnie not to use this leg again. That ain't good. It's horrible, man. Kind of stuff going on in this knee. There is damage to the meniscus, and that's what I'm doing now, removing some of this meniscal tissue here.
I've never seen you clean that much out.
This is definitely far from a simple ACL repair. I'm hoping that does the trick. I think a little bit of that
Feel better?
clicking is gone. Feel better, yeah. So let's see if we can replace the prosthetic. Doing an extra capsule repair, we use a special leader line, and we run it in a figure-8 position that's close to the alignment of the original ACL. Good, that's good right there. Now let's try this leg out. All right.
Pretty good?
Oh, yeah. Feel better than all that doing clicking and grinding we had at first, for sure. Awesome job.
It looks great.
That's probably the toughest repair I've had because we've been in that joint before. There was some meniscal damage that we had to repair, and we replaced those prosthetics. Oh, boy.
Done, ain't you?
Yep, me and the dog done, I think. I'm feeling pretty comfortable after the second surgery that everything's gonna work out. We want to not overuse the leg. I think everything's gonna be fine. It's just gonna be a long process of recovery.
Hi.
Hey.
How'd it go?
Everything went good. It's definitely a challenge the second time through, but we got in and got out. So one of the prosthetic pieces was broken, so that it got it stable again, and we also had meniscal damage. I think that's where most of the issue was coming from. Now, we're just gonna have to take it easy. I wanna be on a leash for the majority of the time.
No running around.
Right, because what will happen is we'll go outside, and here comes the squirrel. We'll take off, and then we'll be back where we started. I'll be checking during that time and kind of let you know when we can lease, but probably at least 2 months.
Okay, thank
Be
you
right back,
so
okay?
much.
All right.
My wife and I are relieved after talking with Dr. Ferguson. It'll be a change, at least for the next couple of months. We'll have to keep her on a leash until she gets better. Not so much letting her out like she used to.
Come on,
Good girl, slow it down, slow it down. Whoa.
That's right, slow down now. We just talked to Mommy about that.
She's always active. It's going to be a change for her, for sure.
Look, we brought Lonnie back.
Oh,
There we go.
Oh, my goodness. You're baby.
All right.
Thank you.
Give me a hug.
Yes, ma'am. You need anything, let us know, okay?
Oh, we will.
All right.
You know it. Thank you.
The Critter Fixers head to a farm to give a group of kids a unique view of what vets do on the job.
Hey, what's going on?
All right.
So today, we're at Coal Creek Ranch, and we're gonna have kids who are from the inner city. They've never been on a farm, so I'm super excited.
Only 2% of veterinarians are black veterinarians. So we're hoping seeing 2 guys that are doing anything can be cool to them.
What y'all think about being on the farm and cow? Really cool. All right, first of all, now, I saw everybody when they walked up, y'all were looking at me and looking straight ahead. You gotta look at the ground. You know why? Cow chip. You know what a cow chip is?
Doo-doo. It's doo-doo.
Doo-doo? That's a good name for it, yeah.
The name of the organization is Fathers Among Men. We work with fathers in the community doing a lot of different activities for fathers to be able to bring their kids out.
Anytime you can get kids out to get a new experience, give them freedom, and they get to learn about a lot of things.
We love giving them new experiences. That's what it's all about.
Y'all see the baby? So sometimes we want to figure out if there's a baby on this side. Anybody have any idea how we do it?
Put your hand in the back.
Come here. You like you done this before. So you gonna check one out for me today? But that's exactly right.
These are gloves. How far you think those gloves go? About right here? So about right here?
Yeah.
I don't want those gloves. Sometimes we have to get down and dirty. Keep going.
I'm about right here.
Ah, now you're getting better. There you go. The kids need to see it so they'll get an appreciation for what we have to do.
It's your second chance at this, kid.
Yeah.
Last time, I had my son, VJ, out here, and, you know, I was trying to teach him how to do it. Keep going. You ain't in the cow. If it's big, you could almost bounce the head like a basketball.
I'm feeling serious.
But this time, we're going to have old Uncle Ferg get in here and to shoot with VJ. All right. Let's go.
You got to tell her to relax.
Relax, please.
There you go. Who said that? Why?
Keep going.
Yeah, okay, got it.
All right, keep going. Remember how we talked about a pelvic drop?
Right? Okay, I got the drop.
Close your eyes and feel.
I feel like something here. I feel like it's on top of my hand, though, like above.
Well, you gotta make a call, boss. You got a 50-50 chance of being right.
Okay, then close then. Pregnant, yeah.
He's bread. Well, say bread loud.
Bread!
Okay.
All right, now let me see if you're lying or not. I got your back, man.
What you got, old man?
BJ, what'd you say?
Bread!
Good job, BJ.
VJ's definitely getting better. I can definitely see improvement. He actually got it right. You know, he'll learn a little bit of me, and he'll learn a little bit from this guy. So it's just the Critifix way to teach everybody and do the best we can.
We don't have any more gloves, but does anybody else want to palpate?
I guess it's safe to say we changed our country folks. It's easy to read in a book about a farm, but when you stand in the middle of a pasture and you seeing cows walking around, I mean, it's amazing. So we will definitely provide this opportunity to more kids. What you think, Bud? Have you ever touched a cow? No?
My favorite part about being out here is when I got to see him palpitate the cow. It was amazing, all out.
Slowly. There you got, yeah.
The vets were cool. They jumped around, we had fun. The cows, I got to feed. I pet a horse. Today was a good day.
Oh, cool.
When I grow up, I want to be a pony helper to help ponies when they're sick.
They having a great time. This is all about learning. We expose the youth to it early enough, and they may be able to walk in you and Dr. Ferguson's footsteps.
We hoping so.
Thank y'all for having us.
Thank you all, man.
Thank y'all.
Appreciate it.
Hey, what's up?
Hi.
How you been?
Good. How are you? Today we brought our goats, Jack and Piper, to get their vaccinations. They are 12 weeks old. They're Nigerian dwarf goats.
My wife wanted goats for pets, so I ended up getting them for her. I like both of them because one's playful and one's cuddly.
Today they're going to get their Clostridium with tetanus in it. And we're going to take care of the family jewels.
Oh.
Usually people don't laugh when I say that. As long as I stay away from you, right?
Yeah. You don't take care of them, they get stinky.
They get stinky, they do.
If you do not fix goats, they tend to pee on themselves in their face because that's how they attract the female goats, because we want to love on them and cuddle them. So we do not want them to do that.
You don't want stinky goats?
No.
They smell good now, though.
Well,
I know, they ain't quite got that nice goat aroma.
You want to do the vaccine?
Yeah, I'll do the vaccine. It is very important for young goats to get their vaccines because their immune system is very prone to more illnesses. We're gonna get these babies vaccinated against Clostridium and tetanus, which is a very harmful bacteria that is found in the soils. So we wanna make sure these guys are safe to go out and just be normal, playful, happy goats. So this one is
Jack.
Jack. All right, Jack. All done with the easy injection part. Got a little present for you, Jack.
Kind of present you want.
We're gonna band Jack.
Yes.
So banding is a painless, non-invasive procedure. You put on these elastic bands and it actually works over time and the testicles eventually fall off. Sometimes we use this as opposed to surgically removing the testicles.
Just alcohol, buddy.
Easy for you to say. And the most important thing, once we pull them through, we make sure we get these teats out the way.
Yeah, watch this teats, right? Don't want to get too much.
When we put an elastic band, you just want to make sure you put it on properly because anything that band is on is actually going to constrict. If you include the teats inside of that elastic band, those teats are definitely going to die, and you're going to have a whole different problem.
It's okay.
It's over.
Yeah. One teat, two teat.
You, my friend, have been banded.
Piper is a little bit more nervous.
Where's my good friend Terrence? He loves banding about like he likes chickens.
Oh.
I'll be right back, guys.
Okay.
Anybody seen Dr. Ferguson?
Yeah, he just went that way.
What's up?
What's going on? I figured I'd bring a tool out for you.
Hold up. Look, you don't ever do that now.
No.
Now, if I'm on this side of the tube, can I be on this side of the
No,
tube?
I'm actually holding the tool.
No, I'm not. Don't come over here, Paul. You trying to take your manhood.
He who holds this tool is in command. So I'm the king of the castle right now.
You better than the king.
Better than
You know who you are? You the king. Just that one level above king. What you got?
I got a cute little goat in here. I'm gonna let you have the honor, so I am presenting you the tool.
Hold on, I might need to do this. Hold on.
I am presenting you the banding tool.
Thank you.
Follow
so I can
me.
be on this side?
Yeah, you get to be on
brother.
this side.
All right, let's go. All right, let's see if we can make this thing work here.
I know how you love banding.
I think he just want me to do the dirty work. Is that what I think it is, man?
So which one works? Banding the goats or examining the chicken?
You know how I am with chickens, but this banding thing is kind of hit a little close to home.
Just a tad.
Just a little close to home, so I definitely feel these little guys.
Make you a little squirmy.
Yeah, definitely a lot squirmy. You let me know how you want to hold it.
Oh, Lord. Piper.
What's up? I'll keep you company here.
He's telling him all about it. He's like, you don't know what's going to happen to you, brother. He's like, run.
Yeah. You're pretty strong now. That's a good kick you got there. This might be a little tough. All right, let's see if we can make something happen here.
He like, no.
I don't blame you. All right. We don't want to have to sedate you, buddy. Just calm down.
No. Your brother was a chimp. Or maybe it was a doctor, too. That could have... Hey, it could have been a doctor. So, T, I know you a gentle giant and nice and delicate, but V, quick on the draw.
Man, I doubt it. But look, you know, I think you got advantage. Harper got a warning signal from the other baby. I mean, it's like, nah.
Look at you going to sleep. You can add goat charmer to my thing. Hey.
Goat charmer.
Hey, look at him sleep. Look at him eyes.
Sleeping.
I am the goat whisperer.
Yeah.
Hey.
All right, that's it.
It's over.
Yeah.
Good to go?
Yes, we are.
Yours is almost as good as mine.
Almost?
Almost.
Well, you know, I use the Ferguson method. You know what the Ferguson
What's
method?
the Ferguson method?
How Hodges do his thing.
Add a hog.
That's right.
Perfect.
Yeah. Without you, it wouldn't work, bro. Yep. Hey, one thing about it.
Yes.
I think we're the best banding duo in the state of Georgia.
You damn right. They're the best looking, too.
I think so.
There you go, buddy.
Good deal.
Tell me about it.
No stinky goats.
At all, ever.
But they look fantastic. You guys have some amazing goats.
Thanks.
Good to see you. As always, dear. Good to see you.
I wasn't sure how they were going to react, especially Jack, but actually he did better than Piper did. Piper was a little bit more nervous. But they did great. It went well. We appreciate everything that Dr. Hodges does for us, so we'll be bringing them back for their checkups from now on.
Dr. Hodges, Paul, and VJ are suited up to visit a local koi rescue.
It was a red clay. You don't see it nowhere else. Did they ever make y'all in art class make them little pots and stuff out of red clay?
Yep. Those were the good old days. You know, that stuff used to get in the clothes. VJ, that's how I know you don't go outside enough.
I go outside enough to know what red clay is.
Yeah, you know what it is, but you ain't got it all in your clothes.
It's all over my shoes. I got a pair of outside shoes with red clay on them.
VJ, you ever pick some wild plums?
Pecans, not plums.
Well, you do have a look country. What is it called?
Pecan.
Pecan.
Oh, it's not pecans?
Pecans.
Maybe I am raising you right. Hey, y'all.
Hello.
How are you?
I'm
Bernard.
good, Mike.
Dr. Hodges, how you doing?
Carmel.
I love it. Amazing setup.
This is our daughter, Thea.
Hey, Thea, pleasure. How are you?
Nice to meet you.
She is studying to be a vet as well.
Yes.
Profession needs some smart, good people, so looking forward to you joining.
Thank you.
Since 2015, we've rescued between 3,000 and 4,000 koi. Most of these koi have been abandoned. They've been on properties, so we get them, we bring them here, we get them better as best we can, and they move on to a better life. There are a lot of people who believe that you can't love them, and you absolutely can. I love my fish.
They look great. You guys are doing an amazing job.
Oh, thank you.
Come on over here. You on the vet side. Come on. I want to kind of look at this guy. This one has a melanoma.
We have recently had a rescue that was just far beyond our normal capabilities. We had great concerns.
I know.
With that massive black spot, when I touched it, it bled.
I don't like that part where it's starting to come up and get under the scales. And so it's lifting the scales up.
Are you thinking of cutting out?
Oh, yeah. Let's see if we can get that out of there. You want to assist me and put a fish on anesthesia?
I would love to.
Today, I'm thinking, let's go ahead and surgically remove this melanoma. It's not gonna actually cure the cancer, but it definitely will give this fish a better quality of life. We're gonna take the water out of here, and then we're gonna recirculate it.
Okay.
He's about to add our fish anesthesia here.
What's that stuff that you were putting in the water?
Clove oil?
Clove oil, which is what I use for anesthesia, is an essential oil from the clove plant. It just anesthetizes the fish, so it just goes down and goes to sleep. I found that it keeps the fish in a correct anesthetic plane. All right, let's grab our fish. What's this fish name?
Cancer.
Well, let's see if we can change their name. All right. What you want to do is go back and forth.
Mm-hmm.
All right, go ahead.
Pushing back and forth.
Yeah, because we want as much water to go through the mouth and come out the gill.
Right, right.
You or I, we get intubated and we breathe. Now, fish don't exactly have lungs. With fish, we gotta make sure we got water that has anesthesia in it, and so we're just running across the gills.
Trying to keep it to where it kind of drains back down in there.
Althea has jumped in. She's giving my anesthesia, so she's basically my anesthesiologist. So we're just prepping it and cleaning it up. Yeah, it's a deep melanoma. You see how deep that is?
Yeah.
I'm just taking it off. How I'm doing, Paul?
Doing good, just keeping these gills moist.
Going pretty deep, because this melanoma is actually pretty deep. In this case, we're gonna take as much as we can so that it's not up under that scale.
You almost done?
Paul, is he starting to come off from anesthesia?
Slightly.
All right.
You almost done it up.
You trying to rush me there, fella? Paul don't talk a lot, but when Paul says, Doc, we need to wrap this up, and I need to get this fish up off of this surgery table. I just want to make sure I get as much of this melanoma out of here as I can. I'm gonna need a few minutes.
You need to hurry up, Doc.
Just give me a little bit longer fishing. Probably gonna be about a minute away.
I'm moving our lip a little bit. Dr. Hodges need to hurry up.
BJ, come here. In my left pocket is some antibiotics. Right here. Let me show you how we give antibiotics. So the caudal fin and the anus is where we get those, what we call IP injections. So we're gonna do a 45-degree angle. You just go right directly in to the abdomen.
Okay.
And you put it in. That'll help recover a lot faster.
You ready to transport it?
Cover tank ready?
It is ready, sir.
Let's recover, bud.
So you just keep swimming him until he wakes up?
Yes, ma'am. Back and forth, right? So nice and easy. So right here. So because we want everything to go through the gills. Keep doing that for a little while longer. Welcome back, buddy. I can breathe a sigh of relief. Cancer came through surgery really well and starting to recover. My trusted assistant helped me here, and maybe we'll name this fish cured now. Let's go over our test.
Our test.
When we initially was getting cancer out of the pond, we noticed that one fish had a huge ulcer. So we actually gonna deliver some antibiotic intraperitoneal. I taught her exactly where we're supposed to give the injection. So you got a perfect shot. So this is your antibiotic.
Oh, hello.
I'm gonna hold them. What degree angle?
45.
45. Here you go.
Okay.
We're gonna turn them up just a little. Perfect.
Okay.
Go up under a scale.
Up under a scale?
Yep. Perfect. Go on in. Deliver your antibiotics. You're done.
Okay.
Good job.
Thank you. When Dr. Hodges tells me that I'm going to be helping, I was a little nervous, but I knew that he needed me, so I, kind of pushed down that anxiety, and I made sure to be there for him. Having him allow me to be a part of the process, it was just really great, and I was very appreciative.
Can she get an internship down there?
Of course you can. We got her covered.
I'm very grateful because Dr. Hodges, being a good fish expert, he's like, here's what we got to do right here and now. The fish had a little chance, and now he has a good fighting chance. And we are going to be renaming him Cure, so we have great hope for this fish at this point.
You got an amazing operation. I mean, it's brilliant, it's needed, and you, pleasure.
Yeah, thank you for your
Soon
help.
I'll be able to retire.
Yep.
All right. Thank y'all so much for having us.
Thank you.
Thank you. Y'all got ready too fast.
Don't let us rush it.
Just standing here looking at
We
me.
chilling. Might be a singing duo. What do you think?
I can't sing.
Dun, 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 dun. That's all I can do. So we background singing.
Hot mess.
Yeah, we background. I tend to get ready for surgery very quickly. So while the techs are prepping the patient, I like to prep the surgery team with the best free medicine that they can get. Ferguson's Freestyle. Jordan, you can sing. We'll be Jordan Howard and the Pips.
Don't do that to me.
Don't do it to you. Come on. Ow. My knee is getting too old for that.
We got one need to
Oh, yeah. Hold on. I don't need to be on the table next to it. Let's get this done first before I go down.
Oh, I love it.
You a wild rabbit? You don't look like a rabbit I seen running around my yard.
A good Samaritan comes to the clinic with a rabbit in need of urgent care.
Hey, boy.
What you see?
Crushed the ears. Got a wound on his back. Yeah.
I was out cleaning the front yard and noticed out of the corner of my eye something hopping in the yard, and I saw it hop again. So I walked over, and there, sure enough, was a bunny hiding under the tree. Then noticed he wasn't well. His ear looked horrible, and then we noticed this god-awful wound. And I cleaned it up, and then I thought, okay, this is really, really bad. I got to get him in ASAP.
Let's see what's going on. There's an ear infection I can see. You can see all the crusties. Oh, boy. Ah.
What you see, Doc?
A pet has pets. This wound is absolutely filled with maggots. What happens oftentimes, animal gets a wound, flies lay their eggs on these wounds, the maggots or larvae starts to eat the flesh.
I need to give him some happy juice?
Give him some happy juice. We're gonna give him a little bit of something to relax him. Maggots are kind of a gift and a curse. Maggots definitely eat up all the flesh and clean the area up, but they also sometimes will die inside the wound, and this causes all kinds of tissue irritation, sepsis, and erosions. So I need to get these maggots out of this rabbit and out of my clinic. We just had to do this case before lunch.
I have a strong stomach now. After being here this many years.
All right, y'all gotta get out of my wound. I'm actually using just a water and a betadine solution to flush all the maggots out. Jeez. Hey, man.
What's up, bro? Ooh, some creepy crawlers.
That's a lot of them.
That's a whole pocket full.
Oh, that's what we need by lunchtime, huh?
All right. Well, no.
Oh, man. They just help me out with a little bit of necrotic tissue, though.
I don't get to pick my cases. Ah, boy.
That's some rough stuff right now.
Sometimes we have some gross stuff that come in and pets that have pets.
Oh, yeah. So, you know, we always put them on your schedule.
Is that why I always end up with them?
That's exactly why. You throwing chickens on mine, I'm throwing the maggots on your schedule. Magnitude of maggots for you. Hold up, don't be flinging now. You look like you flinging in. I think I'm gonna let you have this one. Because that would be a horrible joke if you tried to fling one on me.
Your lunch will taste a little crunchy. I think I'm just gonna open this up so I can really take a good look. With debridement, what you're doing is cutting away all the dead stuff and getting to some good tissue that will actually have a good blood supply. If it doesn't bleed, it don't heal.
Ain't nothing hiding up in there, do you? That part.
Oh, you got another pocket up here.
Yep, I have a few in there.
They're hiding in a deep crevice in the pocket. Jeez. Everywhere, man. Look at that. Everywhere. I need to get all of these maggots out ASAP. Otherwise, this rabbit won't be hopping around any backyard soon. Look at that. Maggots everywhere, man. Everywhere. I did not wake up this morning thinking I was gonna have to flush creepy crawly things out of a wound. All right, maggots, y'all gotta get out of my wound. Good thing we opened it, huh?
Yes, sir.
Definitely gotta get all the maggots out. The last thing we want is maggots dying in our wound. Trying to get the last of these little jokers out. All right, I think it's finally safe to say my wound is maggot-free.
The wound actually don't look that bad, and it really doesn't smell. The maggots did their job.
The maggots actually did their job, because the tissue is actually pretty healthy up in here. The tissue is nice and pink. I'm actually gonna suture it together. We're looking real good. This guy had a couple hundred maggots in it, so I've gotten that wound fixed. I've gotten all the maggots out, most importantly. Time to work on these ears. Some nasty ears, buddy. You're gonna feel a whole lot better. We've gotten those ears clean. I feel very confident this bunny is gonna do great. I guess I'm ready for lunch. I think. First, come on.
They smell better?
Oh, yeah.
Oh, hi, baby.
So the maggots actually started here, came through here. It was easily a few hundred or more.
Probably more than that.
I've got them rid of the maggots, got them sutured up, only missing one thing. Her name.
We're thinking Lucky.
Lucky? Lucky?
I don't know. He doesn't look too lucky right now.
He is lucky. Think about it. Last night, this poor guy was fending off maggots.
Yeah.
Today, he's going to a nice home, new lease on life.
Wasn't hoping to hear hundreds of maggots, so I'm super thankful somebody was able to look after him. We had a name, Lucky, because I think we're lucky to have found him. Then we were willing to take him in, and it could have been anybody else, and who knows what their reaction would have been. Lucky to have him in our lives, and lucky to have found a doctor who was willing to take care of him.
You are good to go.
Thank you so much. I appreciate you so much. Thank
See you later.
you.
No problem. Come on, go to the bathroom so Dad can go to work.
Good morning.
How this baby been doing?
Lonnie the dog is back for a checkup after taking some time to recover from intense knee surgery.
So how's therapy been going?
She's been using her leg, been taking her out every day.
Okay.
After her surgery on her right leg, we removed her stitches, and Dr. Ferguson has been advising us what to do, what not to do for her rehabilitation.
So we want to start doing a little more walking, okay? You can also take a hand here and just kind of push it out real slow there, and then we're going to bring it back up.
I don't know if you can tell her demeanor. She's actually comfortable.
Oh, yes. Just look at these muscles back here. Lonnie is doing fairly well. Last time we had a little atrophy in that leg, so we're hoping to see that muscle is kind of getting a little bit bigger and just see the progress on how we're doing. I can tell we're regaining some muscle mass.
Yes, that's what I was telling you.
Good, yes. The range of motion, you know, that's good there. And
Okay,
tells me that we are
good.
using it. So what I want to do, let's go outside for a minute. Now, let's see how we move around a little bit.
Let's go show them your moves.
Yeah. I'm not expecting to be running around, but I'm hoping to see Lonnie putting the leg down a lot more than we did the last time. I'm very anxious to go ahead and give that all clear signal.
Easy.
You're not leaving yet.
Yeah, not yet.
Do your circle thing with her.
Okay.
Good girl, Lonnie.
There we go. See, we're doing good.
Great.
I'm pleased with where we are. Keep doing those circles. We're doing good, you know, right now to be using as much as we are.
Good girl. Look at that.
All right, Lonnie, we can go back in. I think Lonnie's walking you here. And I'm very happy with where we are. That muscle atrophy that I was a little bit concerned about on the last recheck is getting better, which tells me that we're using that leg a lot as well, which is good. So we're definitely on the road to recovery. She can get back to some of those normal activities. I'm very optimistic, and I feel that we're going to have a full recovery. We're going to keep doing what we're doing, and then other than that, we're good.
Thank you so
All right?
much. Thank you.
All right, thank you.
all.
All right, I'm glad we're doing good.
Lonnie's injury and her surgery has been a long process, but Dr. Ferguson has been phenomenal. We just still have to continue with her rehabilitation, but Lonnie's healing real good. She's in good spirits. Lonnie's part of the family, so we'll do anything to put her at ease for the rest of her life.
Hey, it's a good girl.
They need to build me a barn.
Yeah, you got a boo-boo.
Think of an abscess?
Yep.
I dropped Lexi off this morning to find out why she had an abscess on her cheek. I started freaking out, thinking it was she went outside and got bit by something. I wasn't sure what was going on. She acted like it was really hurting her, so we brought her in.
See that pain and that blood right there? Where there's smoke, there's fire. Meaning, oftentimes we'll get presented animals with an abscess on the top of the jaw. Typically, that means a bad tooth. What happens is there's a bacterial migration from that tooth all the way up the sinuses, and it forms an abscess. It can be quite serious. That pus pocket of bacteria can travel all throughout the body and cause kidney problems. It can make its way to the heart. A simple abscess can cause injuries that could possibly be life-threatening. What you got going on over there, man?
Oh, man, that's a little work.
You want to do some work over here?
Possibly.
Look up here.
Yeah, got a bad tooth there, probably.
Let's put you up, big girl.
It happens.
One of my least favorite things.
Yep, they can be tough sometimes, man.
Oh, boy.
Yep, all right, now knock him down.
Yep, have a juice. I am going to take that bad chipped tooth out. We do a lot of things, but dentistry is definitely one of the hardest things.
It's definitely tough. I just don't like looking in mouths. I don't know how a person could be a dentist. Now we have to be an animal dentist, and they never brush their teeth. Never, ever. So it's just gross in there. Whew.
As a veterinarian, what we got to be?
Everything.
Got to be an obstetrician, pediatrician,
Orthopedic,
gynecologist,
cardiologist,
and a dentist.
And a dentist. Here it is.
And a janitor.
Sometimes
a janitor.
Yeah.
Hey, sweetie, we'll get you fixed up.
And next thing you know, you're waking up and it's all over.
So this is the broken tooth. This tooth is chipped off, and that is causing the infection to get in. So we're gonna get this sucker out of here. I need my rungers. Break this sucker up. These teeth have a lot of roots. You can't really just pull them out. So what we typically do is use some rungers, a handheld tool that fits around the groove of the tooth, and we break those teeth into pieces. And once they're broken into pieces, you're able to start drilling, and then you take each root out one piece at a time. See if we can break it up a little bit.
That makes my mouth hurt.
Still got a little piece in there.
Tough to get out sometimes.
I mean, it's in there pretty good.
Yeah, those tooth, they can be boogers, man, to get out.
Piece. And it's really difficult to get all this tooth out. If we leave just a small portion of that tooth in, it can still be a nodus for infection, and you can get a pus pocket. It can be a really big, big problem.
Your tooth be in there, boy. Being a dentist is not an easy job.
It is not. That is the root, and the root is really inflamed, it's really decayed.
Like it's been eaten away.
The bacteria went around, and it goes up into the sinus cavity. Still got a little bit of the root to drill out.
Sometimes they're tough.
That root's pretty bad.
Here it's coming.
There we go.
What you look like there?
Looks really good.
Yep, I think that's good.
All right, bro. Look like we got to the root of our problem.
Throw a few stitches in there, so this thing should heal up and...
Be fine.
Yeah. Wake her up
So
again.
wake this patient up. Good job, bro.
Yes, sir.
All right. Now we can just let this area drain and everything's a success. Even though dentistry can be a little tough, it's a very important part. And if you're gonna be a veterinarian, you definitely have to be a veterinarian dentist to make everything successful. Hey. How are you?
Baby. I knew she'd have a cone of shame on.
Yeah, so take a peek. This was our culprit. That was the bad tooth. See how, and we actually got stitches in, so I closed it up.
Okay.
So I'll see you in 10 days and I'll pop those out. And this right here will drain on its own. Everything went fantastic. Do you want to keep these as a souvenir?
I'll take a picture.
You sure you don't? I'll put them in Ziploc if you want them.
Do people do that?
Yes.
No, it's okay. That's all yours. Enjoy. I think it's a great thing that they were able to go ahead and take that out today to relieve that pain from her.
Pop up it all.
Can I have my baby now? Aww. Oh, my baby. She was in very good hands today, and I'm very, very pleased with the results that we've gotten. So just to make it through these next 10 days with that cone on is going to be the challenge, I think.
You can't take it off.
10 days. Yeah, I know.
You gotta go home. You can't eat all my grass.
Man, there's one thing that you did that, you know, is real cool.
What was that?
And I don't know what the outcome was. The koi, you removed the melanoma on?
Yeah, it's a deep melanoma. You see how deep that is?
Yeah.
I'm just taking it off. It is doing so much better. Gorgeous fish. And, you know, they recognize how handsome this fish was. They even changed the name from cured to guess what?
What?
Hodges.
Oh, Lord.
We had a very strange case of melanoma, cancer on the fish.
We named him Cured after Dr. Hodges did surgery on it. And we recently wanted to change Cured's name to Hodges as a thank you to Dr. Hodges and the critter fixers for helping us out. But Hodges has been doing great. He is just swimming around happy. He has two little friends, him and his friend Paul, who are in the tank together. His scar looks to be healing. The melanoma hasn't grown back. We're hoping to see some scales soon. But overall, he is still swimming well, he's eating well, and we're really thankful that Dr. Hodges could come out, take a look at him, and make him feel better. We are really thankful for the critter fixers.
Oh, I need to do the happy dance too? Okay, all right. That works right there?
Yeah.
I gotta go side to side? Okay.
Hey.
Hey, how we doing?
I'm fantastic. You doing all right?
Yes, sir.
So is that name still Lucky?
For now.
For now.
Angela's husband brings Lucky back to Critter Fixer to make sure this rescued bunny is healing and finally free of maggots.
Wow. Much better.
a little bit better, right?
And no maggots. It's a whole different rabbit.
Oh, yeah.
It's a tough little bunny, man, to be out there fending for herself. The ears look a whole lot better.
Mm-hmm. Hey, letting you touch them.
So what the kids think about them?
Oh, they love them. They've adopted them.
Well, we're just gonna go clean this area up.
Okay.
We'll take these stitches out and we'll get them fixed up. Give me 1 second.
You got it. Thank you.
Wow, Lucky looks a whole lot better. This rabbit was full of maggots and big hole, and I was concerned. I wasn't sure if we'd live through this ordeal, but the area is starting to heal from the inside out and starting to granulate. I think this rabbit is doing spectacular. I'm blown away. Wow, your ears look a whole lot better. Last time I touched your ears, you were all over the place.
He actually letting you do it.
Yeah, it's definitely always an amazing experience when an animal that's been out in the wild and just having to fend for itself and, you know, basically has no owner. And now has a nice, cozy home with kids to play with. It's a good feeling. It's a win-win situation all around. All right, got that fixed up, took the stitches out. Man, he's a whole different bunny. A lot stronger, though.
Yeah, for sure.
And I got a few more antibiotics for you to give. We should be good to go.
Awesome.
So were you expecting to have a bunny?
No, definitely not expecting to have a bunny. But in our house, you never can tell what you're going to end up with. So kids love him. No, he's been awesome, though. Dr. Hodges done a great job. You know, we were worried about the gash was just so big in his leg. We were worried about him being able to move around, and it's healed up really well for him. We're excited about him being able to do his bunny things.
Appreciate it.
Thank you, sir. I think what's next for Lucky is just going to live his best rabbit life with the other animals we have, and I think he's adopted us, so we'll take him in. Another member of the family.